Okay, we have one final lecture in the prenatal care, or one final section in the prenatal care lecture. We're going to talk about nutrient needs in lactation. Nutrient needs in lactation are similar to pregnancy. There's a recommended increase of around 330 kilocalories in the first 6 months. Nutrient deficiencies do not generally affect the quality of milk unless they're severe. So they tend to affect the nursing mother more than the quality of milk. Excess calorie restriction or inadequate fluid intake is going to affect the quantity of milk more than the quality. Okay, some special circumstances for nursing, food cravings and pica. If they're reasonably healthy, food cravings can help decrease nausea and allow a more balanced diet. Pica is craving non-food substances. It can be an indicator of a nutritional deficiency. It can also be culturally influenced. So if a patient is reporting pica, we need to be checking, in particular, check their iron. Ice is the most common non-food substance craved, and ice cravings have a strong association with anemia. Adolescent pregnancy. A pregnant teenager needs nutrients and energy to support growth and development, but also extra nutrients and energy just to support fetal growth and development. A lot of teenagers have inadequate diets, and they may try to avoid weight gain or even lose weight in pregnancy. So we need to be doing lots and lots of diet teaching. Preeclampsia. There have been people who theorize that either inadequate or excessive intake of some nutrients contribute to or cause preeclampsia. There's no evidence of that. So if you're asked about a preeclampsia diet, we just want them eating a healthy diet. Cultural influences. You want to discuss the patient's preferred food choices with them and help them to choose foods that they like and are culturally acceptable that have the needed nutrients. Food cravings and aversions can sometimes be culturally specific. A vegetarian diet can be adequate for pregnancy and lactation if it's planned carefully. Vegan diet, they should supplement B12, possibly also supplement zinc. Vegetarians need to be taught to combine incomplete proteins so that they're consuming all of the essential amino acids. Exercise in pregnancy, moderate physical activity is a good thing. We want people to be active. Athletes need to listen to their bodies. Athletes have been taught to push through. They need to start listening to those messages, and they may need to adjust for fatigue or other symptoms. We need to ensure that people are getting adequate food and fluid intake for their activity level. Athletes or people participating in outdoor activities need to be aware of heat-related illness. The risk of heat-related illness increases in pregnancy. We also want to counsel people to avoid contact or risky activities and activities that have a sudden intense increase in activity level can be an increased risk. All right, so that's the end of prenatal care lecture.